Gold Star Kenya is a pretty young organization. It's into its fourth year now, and it started as an affiliate of a much bigger NGO, HI 360. However, I'm very happy to say that Gold Star is very fast carving out an identity for itself, and being a health NGO, Gold Star is an organization that is preparing itself, and very soon probably prepared to offer integrated health services. Gold Star has a number of projects currently running, private sector project, and a health promotion project, basically prevention that is related to HIV and TB, and basically other STI, and one that is basically incorporates HIV and other reproductive health services. So I see Gold Star as this organization that is really prepared and standing out there to offer integrated services to communities so that they can actually take charge of their own health. Talking of Gold Star Network, I would say one of the first of its kind, 7 years in business. Before anyone else could talk about social franchising, Gold Star Network was around, so that I can say it's sort of like a trendsetter. GSN started as it's a fractional social franchise, implementing mainly in the area of HIV and TB, and now getting into reproductive health services. The architect of this network had a very good vision. They identified a need, a gap that existed. That's 7 years ago, where a lot of effort was focused on the public sector, building the capacity of the public sector to offer quality services, HIV and TB services. That is both prevention, care and treatment, and leaving out the private sector, where up to 40% more, actually different estimates put it at different levels, but anything up to 50% of the population actually seek their health services. Gold Star Network came in at a very timely point, where the people who also went to the private sector paid a fee for service, were also entitled to quality care and treatment, and even prevention services. So I see Gold Star as that initiative that has really bridged this gap, being able to represent the private sector in decision-making forums, policy development processes, so that then the needs of the private sector and their clients are consistently captured in any new policies, any new decisions that are being made on behalf of the health sector. There's one case where Gold Star would like to probably have the resources to develop their own capacity to be able to offer all these services. And where that is not possible, the resources are not available, then I see a situation where Gold Star Network can actually work with other franchises that are already strong in those specific areas to build their either to build the capacity of Gold Star Network to offer those services, or to actually come and partner with Gold Star in the same, say for example, facilities that are members of the network, such that one provider who is stronger in reproductive health, for example, can come and offer services where Gold Star is already offering HIV and TB support. We are actually members of consortiums, and we are coming in as strategic partners to offer HIV, TB, and in areas where we are present, and even reproductive health services in areas where the other franchises are not present, while those other franchises are also, as part of the same consortium, then coming in to offer the services that they are stronger in, reproductive health services, for example. We are at an advanced stage, actually as soon as early as next week, Monday. We'll be launching an association that has come together again significantly due to the benevolence of some of our donors, especially USAID has been very, very supportive of this project, where all the social franchises. About 6 of us are actually coming together as the founding members of an association known as the Association of Social Franchising for Health, that we believe will be a very good vehicle for advancing the interests of the private sector, private health sector, through social franchising. Yeah, so I think we are all very excited. We are looking forward to a situation where then the benefits of harnessing, the benefits of putting together people with various strengths can actually be consolidated. We see the association coming in as a very good voice for the community, both the community that accesses services and the service providers that offer the service, and then the organizations that are involved in this. The fact that Gold Star Network actually has grown over the last 7 years, we haven't varied Gold Star Network, means it is a sustainable model of service provision, especially if you deliver what you promise. The biggest strength for Gold Star Network is that they've been able to ensure that there's that trust between the network and the members. And the members, so that then you have members that have been actually with it since the beginning, who are still there, they are advocates of the network. That for me really, really excites me. But it's a really new concept in the Kenyan market. Trying to sell the concept of social franchising to, say, for example, policymakers in government has been a bit slow, but it's slowly actually gaining foothold. So it is a sustainable model. Social franchising is not about free services, even though as much as it may be about affordable, it's not about free. And I see anything that is not free as sustainable. Yes, I see anything as sustainable. We also have a case where basically other people are seeking to come and work through the network. Yeah, pharmaceutical providers, people who are having products and equipment that could benefit the providers, are opting to work through the social franchises as opposed to going to individual service providers. Yeah, service provision, providers out there in the market, for example, laboratory service providers. It could even be imaging or diagnostic services, for example. Yeah, training institutions. Gold Star Network actually attracting even fellows from university. We are having universities sending some of their fellows that are in their fellowship programs to come and study the Gold Star model, which means this is actually something that is exciting everyone around. And I see social franchising as a sustainable model that can actually survive beyond donor funding, beyond the mother organizations, and actually stand out there by itself. As long as we convince our customers, our clients, who are the service providers, and the service providers that are the member service providers, and the community, the clients that access these services, that this is actually the way the place to be. We are going to non-communicable diseases. We are looking for ways to mobilize resources to actually offer these services. Because then we also accept that, we also appreciate that even that HIV patient who comes, that patient who may be HIV positive come to your clinic, could be having more than just a problem with HIV. And with HIV right now, for example, with immunosuppression, then you get even non-communicable diseases. Actually, such patients being vulnerable to many more conditions. So we like a person walking to one hospital, one facility, one clinic, and getting everything they need there, and not having to walk around. Because what happens also is people get frustrated, and they prefer to go to a place where they can get everything ready. Yeah, so I believe we'll be addressing the need of the market and the customer if we can actually integrate many more services. We draw strength in the fact that as a provider who's trained, even when they move on, we hope that wherever they go, they're able to offer they continue offering quality service. I would like to see an organization that is, first of all, driven with a very clear strategic plan, And I would like to see Gold Star Kenya as an organization that is preferred by partners. Any partner looking for an organization that offers value in terms of this contractor that actually offers value for money, and has expertise, actually uses evidence to carry out the activities. I would like to see an organization that is well funded to offer integrated healthcare. Health services, actually not just healthcare, health services. There are a lot of other things that are happening around us that have impact on health. I mean, environment, water and sanitation, the climate change, and we are basically thinking about going green in just about everything. I would like to see Gold Star Kenya as this organization that has various departments with various expertise, a wide range of expertise, to actually address the health of the communities in a more comprehensive and holistic approach. I would like to see Gold Star Kenya as an organization that, for example, the government prefers to work with. Yes, because we are a legal organization. We are an organization that implements according to the guidelines that government has put in place. I mean, we may be in the private sector, but we are still subject to the same government. And I would like to see a situation where government sees us as an organization that offers expertise in the area of the private sector. And I would actually want to see Gold Star diversified much outside of just the private sector. There are a lot of public health gaps that exist out there. So I'm dreaming big. I would like to see Gold Star Kenya be the organization where people prefer to work. We are determined to be this preferred organization. We are not, this is not just rhetoric. We would like actually to be the organization that is implementing quality, tested, evidence-based initiatives out there in the market. We are already doing that, but we know that there's always room for improvement.